We've discussed breast augmentation on Great Day many times, but today we want to talk about breast reconstruction, surgery to rebuild a breast after a mastectomy. And it's more common than you think. Dr. Diederich from MidAmerica Plastic Surgery is here with two of his patients, including Mary, who just had breast reconstruction a week ago. And again, this is more common than we think because 1 out of every 8 women in the United States will face breast cancer at some time in their life.
Absolutely, yes. 1 in 8, and that number, if you have a family history, can actually even be up to double that number.
Oh my goodness.
So it's a very common problem.
Like Tanya, your mother was diagnosed with breast cancer.
Yes.
So let's talk about, how this has changed your lives. Because, obviously going through breast cancer in itself is just life-altering. But what is it like when you have to go through a mastectomy and you lose part of your form, your shape?
Yes, it was very difficult at first. Especially just getting clothes to fit. Every time I'd go out of the house, it's like, okay, this doesn't fit, I don't know.
Yeah, and Mary?
Yeah, I think that looking down and seeing that hole every day is kind of a big reminder every day of what you've been through. So doing the reconstruction has been really good, so I can kind of move on and heal from all of that. So.
Well, and we're going to talk about how it's changed your life in a bit, but first, Dr. Diederich, unless you are faced with something like this, you don't even think about how in the world this is even possible to reconstruct a breast from, basically starting from scratch.
Absolutely.
And so how does that work?
There's many different ways of breast reconstruction. These range from using implants to reconstruct the breast to using the patient's own tissue, whether it be from the abdomen, the back, or other areas of the body to recreate the breast they desire.
And Mary, he was able to take part of your stomach actually to reconstruct it?
Yes, all the fatty part down here came up.
And so now that you've completed the surgery a week ago, how do you feel?
Yeah, a week ago today we were in surgery at this
goodness.
time. Yeah. I'm still moving a little slowly, but I'm feeling really good, and I'm still happy that I did it.
You are happy that you did it. Absolutely. I read that most women are always, happy that they went through it.
Absolutely, absolutely.
And does it feel like, your other breast? Does it feel like,
Yeah, it actually is me because it was the fat part of my tummy that came up. So it feels like part of me because it is, and it's warm now. So, it's really different than having that implant or having the thing that was there before, so it's good.
Well, and there's no sensation, right? That's the difference.
Correct. Yeah, there is no sensation with this because during the cancer surgery, actually, the nerves that would supply sensation are taken.
Okay.
But it does provide a much better balance. And one of the #1 reasons we see people wanting reconstruction is because of those prostheses that they're wearing. Mm-hmm. They're warm, they're uncomfortable, as you know, and just to look better in clothing and kind of make a whole process to complete it and feel whole again.
Now, you brought a couple of things to kind of illustrate what exactly the process is, because it's actually 2, sometimes 3 surgeries.
It can be. It can be multiple surgeries, and each depends on the type of reconstruction you have. For example, Tanya had a implant reconstruction as the plan. So initially, she had bilateral mastectomy, both breasts were taken, and then an expander was placed. Then over the course of a couple months, this is filled with fluid, and it gets larger to stretch the skin and make the area for the implant to go.
So unlike Mary, you're not taking tissue from another part of your body. You're actually going to do the expander, which you're in the process of right now, and then later you'll have the implant put in.
Correct.
Okay, and then there's a third procedure.
And often we'll come back then. Sometimes you need to have revisions of the breast to get it just exactly like you want it, as well as recreate the nipple is at a later procedure.
And one thing I was also shocked by is that insurance does cover this.
That's one of the great things. By law, they're required not only to cover the cancer surgery, they're required to cover the reconstruction, but also any symmetry procedure to make the other breast match the new reconstructed breast.
So both of them, okay.
Yeah.
And then there's something else that we talked about the last time you were here that is really just great as far as technology. There's now this 3D imaging technology so that before any woman, whether it's reconstruction or augmentation, goes under the knife, they can actually see exactly what they're going to look like. And you guys both did this, didn't you?
Yes.
So what was that like, being able to see, with your body, this is what I'm going to look like with the size that I've selected?
It was pretty neat. It wasn't so neat seeing you before. It's like, oh, it needed improvement, so it was exciting.
Yeah. That can be a little scary too.
Yeah, but it was good. You could actually see and know that you would look good when it was finished. So.
And this is not just for the breast. You can also do this if people want to get, rhinoplasty or a nose job.
Exactly. It works from head to toe, basically, from many different areas. And not only does it show you the results, what's great is it's a wonderful tool to plan. We can measure volumes, we can measure different distances we need to get the best result possible.
Well, thank you, women, so much for coming on and sharing your story with us. And thank you. And what's great is that you can learn more about MidAmerica Plastic Surgeries and the procedures that they do at a seminar that's coming up in August in O'Fallon, Illinois. If you mention Great Day St. Louis, they'll waive the consultation fee. For more information, visit MidAmericaPlasticSurgery.com or call 618-288-7855. Thank you so much.
Thank you.
Matt?
Virginia, thank you. And ladies, thanks for sharing your experiences. We appreciate that.